Hello everyone. In this presentation we'll be taking a look at somewhat modern surgical and non-surgical modalities that have been developed in the past few decades to facilitate the operative work. This presentation will be split into two parts between me and my good friend Mark. The first part will be taking a look at the surgical procedures in general. Surgery is an integral part of therapeutic modalities. It represents an invasive treatment option to which we resort when the case necessitates it. The first evidence of surgical procedure is that of trephining, or cutting a small hole in the head with an instrument called trephine. This procedure was practiced as early as 3000 BC, and since then, new therapeutic and surgical modalities have been developed that incorporated a variety of special instruments for a variety of purposes. In this presentation, we will be focusing specifically on three of the rather modern types of these modalities, which are laser, cryosurgery, and hilotherapy. First one, we'll be taking a look at laser. Laser, which is essentially light amplification by stimulated emission of radiation, is a device that amplifies light and produces highly directional, high-intensity, coherent and monochromatic beam of light or other electromagnetic radiation by stimulated emission of photons from excited atoms or molecules. The mechanism of light, essentially, as you see before, the components are a resonator or an energy source that powers an amplifying medium surrounded by two reflecting mirrors, fully reflecting and partially reflected. The procedure is, or the mechanism essentially, is stimulation of the amplifying medium to produce a high intensity beam of light that will be bounced forward and backward between these two reflecting mirrors and intensifies into one highly directional, high energy beam of light that will be emerging or exiting from the partial transmitting mirror. But the laser makes use of processes that increase or amplify light signals after those signals have been generated by other means as well. As for the mechanism of laser tissue interactions, for therapeutic purposes, laser tissue interactions are mainly determined by two parameters, namely the laser exposure time on the tissue and the effective power intensity taken into account the tissue-specific absorption. Several laser tissue interactions have been observed, mainly coagulation, which is when the laser hits the tissue at a normal body temperature of 37 centigrade and then it heats it to over 60 centigrade, which coagulates the blood and stop oozing at the ablated tissue margins, like incision and excision procedures, for example. Photovaporization is the second interaction between laser and tissue. With high energy, highly focused laser hits the tissue, it produces surface temperature exceeding 100 centigrade, which causes tissue vaporization. The third one is ablation, which is a mode of action used when we need to selectively remove thin layers of material, causing a relatively little or small thermal damage to the adjacent area. Photodisruption, when the extremely localized high-power laser pulse hits the tissue, it will generate very high energy electric field, which causes electrical breakdown at the tissue interface, resulting in ionization and plasma production. As I said, however, whether a laser system is suitable for incision, vaporization or coagulation is determined by its wavelength, the energy fluence, and the optical characteristic of the tissue, and how the laser is operated, essentially. In continuous mode, the laser provides a constant and stable delivery of energy. Laser within the ultraviolet region, which is between 100 and 380 nanometers, are able to ionize tissues in a process known as photochemical distortion or desorption. Lasers of longer wavelength, especially those within the infrared part of the spectrum, cause significant tissue heating, and most of surgical lasers are embedded in these groups anyway and comprise the thermal laser. The light of this laser is rapidly converted to thermal energy, causing denaturation of proteins, decomposition of tissue, microexplosion of cell water, and charring. Type of laser in dentistry. Lasers are classified according to the medium they use, the duration of laser emission, and with respect to hazard based on power. As for the types of laser in dentistry, we have several types that have been used in dentistry over the past decade. First one is the carbon dioxide laser, has an excellent affinity to water-based tissues, and wavelength permits it to be readily absorbed by water. Thus, it will not penetrate too far into the tissue, and without repeated or prolonged use, making it ideal for superficial lesion and resurfacing of the skin, but also usually used for removal of cellulite, which is stones in the salivary glands. Second one is the neodymium YAG laser, which are frequently used in bone and cartilage ablation. Others include holmium YAG lasers, erbium YAG garnet laser, argon diode, excimer laser, and so on and so forth. Applications of laser in dentistry. Laser has many indications in medicine, like optics, treatment of vascular lesion, and laser hair removal, and so on. But in the dental specialty, laser has weaved its way into several dental branches, including conservative dentistry, cosmetic dentistry, endodontics, periodontal therapy, biopsy, and sterilization of instrument. First, conservative dentistry. Lasers have been used in conservative dentistry for detection and removal of caries, as well as photopolymerization. In cosmetic dentistry, lasers have been used for teeth whitenings. In endodontics, lasers have been used for sterilization and preparation of the canals of the teeth to receive the filling. In periodontal therapy, lasers have been used for performing surgical procedure to excite or excise redundant and inflamed gingival tissues. For biopsy and lesion removal, lasers have been used to obtain excisional or incisional biopsy for microscopic examination. And finally, lasers have been used for sterilization of instrument very effectively, actually. Now, laser in oral and maxillofacial surgery, which is the main subject of this presentation. Lasers have rapidly become the standard of care for many procedures performed by oral and maxillofacial surgeons. The reason for this transition is due to the fact that many procedures can be executed more efficiently and with less morbidity using laser as compared to other scalpel instruments. Electrocautery or high frequency devices as well have been replaced with laser. For the advantages of laser in the oral maxillofacial surgery, laser has excellent hemostasis effect because of its high energy and the thermal status that will enable it to clot or coagulate the blood vessels as soon as it hits them. Laser, due to its small size, provide excellent field visibility and precision and infection control due to non-contact operation. Also, reduce post-operative pain and edema, lack of scarring and tissue shrinkage, microsurgical capabilities, and a lot of advantages over the other surgical procedure in the oral maxillofacial surgery. As for the specific application of laser in these branches or in this field, potentially, laser is used for osteotomy, as laser are well absorbed by hydroxyapatite, collagen, and water. Lasers are used in osteotomy to perform several procedures. The main lasers are used are carbon dioxide laser and the erbium YAG laser. Laser also used in excision of benign and malignant and potentially malignant oral lesion. As for benign lesion, excisions of these lesions such as fibroma, papilloma, mucocele, and gingival lesions have been performed extensively in the past years. Removal of these lesions using laser is minimally invasive and can make the surgery less extensive or expensive and may reduce the need for general anesthesia or inpatient hospital care, resulting in the lowered overall cost. It has also been used for removal of other potential malignant and malignant lesions such as leukoplakia and squamous cell carcinoma. Congenital vascular malformations in craniomaxillofacial surgery. Laser therapy is indicated in the treatment of congenital vascular malformations such as hemangioma or nevi flammei, which are treated by argon or dye lasers. TMJ, laser assisted surgery. Arthroscopic surgery has become the treatment of choice for internal derangements of the temporomandibular joint and other procedures like discectomy and discoplasty using carbon dioxide laser and other more complicated lasers. I presume. Another specialty for the dental surgery using lasers are implantology, which is the most important indication of laser treatment is implantology is the peri-implant mucogingival surgery, as well as the contamination of the implant. Plus, in order to treat peri-implantology bony defects and rehabilitate failing implants. That's it for implantology, I guess. And finally, lasers have been used in aesthetic and plastic indications. Superficial, vascular, and pigmented lesions are most commonly treated with the use of argon lasers, which is used for treatment of deep vascular lesions and tumors. The carbon dioxide laser is indicated for vaporization of exophytic lesions. One of the most common procedures performed with laser is cosmetic skin resurfacing by removing the surface layer of the epidermis and the superficial papillary dermis, contracting the dermal collagen and allowing the skin to re-epithelialize in a more uniform manner. The advantage of laser surgery in case of aesthetic and plastic surgery is based on hemostasis, decreased scarring, and decreased post-operative disability. That's it for my part. I will leave you with my good friend Mark to continue with cryosurgery and hilotherapy. Thank you.
Hi, this is part 2 of our seminar project. My name is Mark and my presentation is talking about cryosurgery and hilotherapy. First, we will begin with the definition of cryosurgery. Cryosurgery is the use of extreme cold in surgery to destroy abnormal or diseased tissue. Thus, it is the surgical application of cryoablation. Cryosurgery works by taking advantage of the destructive force of freezing temperatures on cells. At low temperatures, ice crystals form inside the cell which can tear them apart, as we can see in this picture ahead. Cryoprobe is the surgical instrument with a cold tip. The temperature is determined by the boiling point of the refrigerant liquid inside the cryoprobe. History of cryosurgery. How it is begun. The first cryogens were liquid air and compressed carbon dioxide snow. Liquid nitrogen became available in 1940s and currently is the most widely used cryogen. In 1961, Cooper and Lee developed the first cryotherapy probe system involving the circulation of liquid nitrogen through a closed metal tube placed in direct contact with the target tissue اللي هو نفس الكرايوبروب. هسه نجي على الكرايوجينز وأنواعهم. أول واحد عندنا واللي أكثر شي استخداما هو الليكويد نيتروجين توصل درجة حرارته للسالب 196 Celsius. Super cooled liquid may be sprayed using cryogun on the diseased tissue اللي هو نفس الكرايوبروب or simply dabbed on with a cotton or foam swab. ثاني واحد solidified CO2 يسموه dry ice أو CO2 snow حرارته توصل سالب 78. مو كل شوية يستخدموه. Doctors use carbon dioxide snow formed into a cylinder or mixed with acetone to form a sludge that's applied directly to the tissues. وعندنا بعد النيتروس أوكسايد والأرغون. هسه نجي نحكي عن استخدامات الكرايوسيرجري بالأورال سيرجري. أول شي ablation of warts, small tumors. Healing is good with minimal scarring يسوينا. Ablation of hemangiomas has the advantage there is no hemorrhage and the surface may be left intact تبقى سليمة. Treatment of bony cavities. Reduce recurrence of lesions such as odontogenic keratocyst or central giant cell granuloma. وآخر شي blocking of nerves. The most common condition treated in this way is trigeminal neuralgia that no longer responds to therapy with drugs. Methods of cryotherapy. عندنا two systems واثنيناتهم يحتاجون للكرايوجين. أول واحد اللي هو open system. It involves direct application by cotton pellets or a spray. The heat is released by vaporization due to drop in temperature. تستخدم when no control over depth is required. عندنا system ثاني closed system. This is based on three principles. thermoelectric, evaporative و Joule Thomson effect تستخدم when depth orientation is required. هسه نجي للابليكيشن تكنيك شلون نسوي له application للcryotherapy. عندنا اثنين probe freezing. It is done by direct application of probe tip to the lesion. The cryogen circulates through the probe tip and supercools it when allowed to contact the target tissue. بالcontact freezing, firm contact is made between the cryoprobe and the target tissue. بس بالpenetration freezing, probe penetrates the target tissue providing a large area of direct contact. عندنا spray freezing. It is done by direct application of liquid nitrogen to the tissues and is the most destructive method لأنه درجة البرودة كلش عالية تصير وسبراي يعني ينتشر بكل مكان. Liquid nitrogen is delivered to the target tissue at such a volume and velocity that it evaporates at the edge of the lesion. بأول صورة راح نشوف الخلايا بصورة طبيعية قبل العلاج. بالصورة الثانية راح نشوف تكون ice crystals بداخل الخلايا. الصورة الثالثة ice crystals راح تكبر تاخذ يعني أغلب حجم الخلية. وبعدين بالصورة الأخيرة راح نشوف من يذوب هذا ice crystals راح يترك لنا خلايا ميتة. Mechanisms of cryosurgery. أنا اختصرتها بهذا الجدول أحسن مما حاجة طويل فراح أشرحها أنا بهاي الطريقة. عندنا نوعين لو immediate cell destruction لو delay يعني لو تقتل قبل للخلية لو delay نسوي شوية. فأكو طريقتين إنه immediate cell destruction أما عن طريق الكولينج البرودة العالية عن طريق الهايبوثيرمي أكيد لو بالفريزنج وبيها ثلاثة أنواع هاي الفريزنج extracellular أو intracellular ice crystallization وكو بالليثال temperature اللي هي من -20 لناقص 50 تقتل الخلية. الديليد سيل ديستركشن شلون هاي تصير؟ يسوي vascular stasis بحيث الدم ما يوصل هالخلية فتموت ينقطع عنها. controlling parameters during cryosurgery هم 4 لازم نتحكم بيهم احنا. cooling rate in cryosurgery rapid cooling rate produces intracellular ice crystals which is more destructive. Such higher rates of cooling can be only achieved close to the cryoprobe. The temperature measure stated that the lethal temperature range between 50 إلى 500 centigrade. The treatment of tumor requires a tissue temperature at which all the abnormal cells are certainly dead. عندنا thawing rate ذوبان لازم يكون بطيء و continued for longer time period. rapid thaw rates allow cell survives يعني لازم نخليه كلش بطيء بسرعة الذوبان. repetitive freeze thaw cycle. Rapid freezing and slow thawing do not guarantee effective cell destruction. لازم نخلي repetitive هاي العملية على نضمن إنه كل الخلايا حتموت. Advantages and disadvantages of cryosurgery. Advantages: no hemorrhage, minimal post-operative pain, good recovery of nerve function, minimal scarring, bone structure maintained, blood vessel recovery, adjacent normal tissue recover, excellent for hemangiomas, possible treatment of painful nerve lesions. And disadvantages: healing is slow. In lesions of the tongue, the procedure can limit its function. Or volume of lesion can be beyond capacity. Extensive lesions are difficult to treat. Lesions that can be treated with cryoprobe: adenomas, epules, papillomas, granulomas, warts, small sarcoids, وeylet tumors. هنا بهاي الصور نقدر نشوف الحالات اللي نقدر نعالجها بالكرايوبروب أو الكرايوسيرجري. هنا هم نفس الشي. الcontraindications للكرايوسيرجري أول شي cold urticarial patient develop redness and swelling in the skin. Cryo globulinemia, abnormal blood protein results in gel formation resulting in ischemia or gangrene. Raynaud phenomena, paroxysmal called hemoglobinuria. Hemoglobin is released from lymph red cells and is excreted in urine. Peripheral vascular disease or patients undergoing immunosuppressive therapy. هسه نجي على conclusion. Cryotherapy is an effective treatment method for a variety of lesions of the head and neck region. It is advantageous over surgery and is well accepted by patients. Many times it is used when conventional therapy either fails or is contraindicated, but unless the physician confirms the diagnosis and volume of lesion, it is not advisable to use it. بس الموضوع الثاني اللي هو الهيلوثيرابي. الهيلوثيرابي is an advanced thermal therapy that helps reduce pain, swelling, tissue damage, and muscle spasms. It is the recovery treatment of choice for the world's leading athletes and surgeons. It depends on the application of cold compression at a regulated temperature through a face mask. Hilotherapy has a wide range of applications, but central to all of them is the goal of nature faster to full health. Not only does hilotherapy promote the healing of damaged tissue, but it also reduces pain intensity, diminishing the need for increased analgesia. Mechanism of hilotherapy. The thermal effect is generated by the medium of distilled water. It is adjusted to the desired temperature from 10 to 35 centigrade, accurate to the nearest degree, and special dedicated therapy devices constantly maintained at this level. This helps to ensure the medically required temperature is consistently and precisely provided. It can be applied for many hours or even days on end without any deviations. Sensors constantly monitor the relevant figures and ensure consistency. Within a closed-loop system, the cooled water flows through anatomically formed cuffs available for various parts of the body in the form of disposable or reusable devices. Indications of hilotherapy. استخدمها بالtraumatic or preoperative pre والintra والpost operative. أول شي edema, hematomas, pain relief, sprains, pulled muscles, muscle tears, dislocations, tendinitis, inflammatory rheumatism, hand-foot syndrome, sciatica, fever, migraine, or functional rehabilitation, for example, improving mobility and loosening muscles. This is the end. Thank you for listening.